Hello, I am Dr. Anshu Gupta, MDS, Director of Advanced Dental Care Center, Chandigarh, India. We are the leaders in dental tourism in India and specialize in dental implants, cosmetic dentistry and orthodontics. For any queries, you can call us at 9855123234. In today's video, I am going to show you the procedure for cementation of full mouth porcelain veneers. We have a patient who is suffering from the teeth fluorosis and he wants to change the color of his teeth. So we have planned 20 veneers in his case, starting from upper second premolar on one side to the second premolar on the opposite side, and similarly in the lower arch. So in total we will be doing 20 teeth veneers from 5 to 5 in the upper arch and 5 to 5 in the lower arch. Here are the veneers. This is the upper model showing the beautifully made IPS EMAX all porcelain ceramic veneers in shade B1, and this is the lower model showing beautifully made IPS EMAX porcelain veneers in shade B1 from second premolar on one side to the second premolar on opposite side. The patient was not desiring any correction in the alignment of the lower interiors. He was fine with the way his teeth were. He just wanted to change the color of his teeth. So basically it is a 5-stage procedure. In first step, we basically remove the temporary veneers that we have already cemented in the patient's mouth after the tooth preparations have been done. So when the patient will come, we will first remove his temporary veneers, try these final veneers in his mouth, and if he is satisfied completely, then we will start with the process of getting the veneers ready to be pasted in the mouth. So in the first stage, we have to use this etchant. This is the Porcelain Edge Gel used for the etching of the porcelain veneer. This has to be applied for 60 seconds, and once the 60 seconds are over, we gently rinse off the gel with a gentle stream of water, and then we use this silane to apply on the veneers. This silane is allowed to dry and evaporate on its own. This is the cement that I will be using today for the cementation. This is the white opaque cement from 3M, and on the tooth we have to use the normal etching gel on the tooth surface for 15 to 20 seconds, then gently rinse it off with a gentle stream of water, dry the tooth, and then we have to apply this bond. This is again from 3M single bond. We have to apply this bond. We first have to rub it onto the tooth surface, then gently blow dry with a stream of air, then again reapply and again gently blow dry, and then cure the bond. In the meanwhile, our veneers will have gotten ready with the porcelain edge and the silane, and then we will start the process of cementation one by one once all these steps are over. Thank you. So this is our lovely patient, Mr. Tajinder Singh. He is 23 years old and he is visiting us from New York. He has the complaint of discoloration of teeth because of fluorosis. So in the last appointment, I already did his tooth preparations for the porcelain veneers with a tapered round 13 number burr, making a chamfer margin all around the tooth preparations, and I made his temporary veneers. Let me show you. These are his temporary veneers that I made with composite light. Now I am going to remove these temporary veneers one by one to try on his final veneers. So see how we remove the temporary veneers. Open. So, we have made the temporary veneers in such a way that they can be engaged at one point and simply be removed like this, so that we don't have to literally grind the temporary veneer off the tooth. Alright, just open your mouth, sir. See, this is the way we are going to remove one by one. Open. See how easy it is. Open, sir. Whatever is left, we can maybe use an air router later on to remove any remnant, if at all there is any. Open. See, I have removed all the temporary veneers from the upper arch. Similarly, I will be doing in the lower arch. one by one and placing them on the exact same position in the model. Every one of you can see, I guess. My hands is slippery because of this lubricant gel. Okay. Alright, I have removed all the upper veneers and placed them back on the model in their respective positions. And I'm going to put this model at a side now till the time. In the meanwhile, I will start doing the trialing of the lower veneers. I'm going to put the refractor again. Alright, sir. So here goes the first veneer.
No, sir.
No, itna nahi. Here goes the second one. And here goes the third one. The fit, as we can all see, is really nice, very nice. My technician has done a very good job in making these. The hand gets really slippery because of the gel, but then it's a very good aid. We also cannot do without it. As we can all see, all the trials are going to be just completed. Just 2 teeth are left. I'm very happy and satisfied with the way the veneers are fitting. I'm really thankful to my skilled technician who has done this lovely job for me. Alright, section. Back in place on the model. Now I'm going to keep this model also at one side. Now I am going to prepare each veneer individually. I will show you the step for one. So these are our upper veneers, right? I am going to take off one incisor. Since there is a lot of gel that I applied, I am just going to wash it off and rinse it off first. Get me a kidney tray. So I have removed the gel and cleaned and dried the veneer. Now I'm going to apply the porcelain edge gel onto the entire tooth surface. Now 60 seconds have elapsed and I am going to gently rinse off the gel with the gentle slow gentle stream of water. Then I am going to dry the veneer. You can see the white etched surface of the veneer. I am now going to apply the silane. Keep it at one side. We will allow this to dry. Similarly, we will make all the veneers ready in the same manner. Let me show you another one. Here is the veneer. We have applied the porcelain gel. Similarly, I will be preparing all the veneers. Let me show you this one again. This is the veneer we have dried. Now again the silane would be applied. In the same manner I am going to prepare all the veneers first before doing anything in the mouth again now. Now here all the washed and dried veneers. These are the upper ones and I have applied the porcelain edge gel. We will wait for 60 seconds and then rinse off the gel and dry it and then apply silane. Now here all the washed and dried veneers. These are the upper ones and I have applied the porcelain edge gel. We will wait for 60 seconds and then rinse off the gel and dry it and then apply silane. Here are the washed and dried lower veneers and I am going to apply the porcelain edge gel one by one. As you can all see, it has to be applied thoroughly on the complete inside of the tooth surface, which knows, as well as the margins should all be covered thoroughly. It should be copiously applied, not miserly. Syringe door. So you can see all the upper and lower veneers, they have been washed, dried and the porcelain edge gel has been applied. Now the upper veneers are ready. We are going to remove the and rinse off the porcelain edge gels gently one by one. I have kept a bowl here so that in case the veneer slips, it doesn't fall off anywhere else, because it will be difficult to get one veneer remade for such a big case. So these small steps are very important. These are small tips I am giving you guys. Alright, so I have removed the gel from all the upper veneers almost. Now I am going to dry one by one again. Show you how I dry them so that the veneer doesn't slip. I will simply hold it against this towel and blow dry it. I think you guys can appreciate the etched surface here. As you can all see, and I am going to apply the silane one by one. I am not applying silane on the central incisors as we have done earlier. We will allow this to dry now. All the upper and lower veneers which have been thoroughly prepared, we have washed them, dried them, applied the porcelain edge gel, washed it, dried it and then applied the silane. The silane has also dried. So these are the upper veneers and these are the lower veneers. I hope I have made myself clear till now. Now we are going to go to the patient. This is a three-way retractor that I use for the cementation during the cementation of porcelain veneers and my other cosmetic procedures. This gives a very good lip, cheek and tongue retraction at the same time. Just close down your mouth, sir. Are you feeling comfortable? We will first do the cementation of the upper veneers. So I am going to dry the tooth surface. The patient will experience a little bit of sensitivity, as you can all see. I want light. I am going to apply the etchant on all the tooth surfaces where we intend to place the veneers. I am using the total etch technique, so I will first apply this etchant, leave it on for 15 to 20 seconds, then dry it and then wash the tooth surface and dry it, and then I will apply the 3M single bond which I showed to you in my video earlier. So now we have applied the gel. I am now going to take a micro brush and apply this bond onto the surface of the tooth. Light off a bit. So you have to literally rub the bond. Just close your mouth a little. You have to literally scrub the bond into the tooth surface so that it penetrates all the tooth area properly. So we have to use scrub, scrub, scrub. Similarly on the opposite side. Suction. Light. Suction. I have applied bond on all the tooth surfaces. And I am going to gently blow it with the stream of air. And I am now going to reapply the bond suction on the coat. Applied it second time, rub it again onto all the tooth surfaces. Just leave it. Now I'm going to gently dry the bond again. Remove the second thing. Floss. I am going to floss all the interdental areas so that if there is any excess bond stuck here, it should not get cured and then interfere with the cementation of my veneer later on. This is a very important step that needs to be followed religiously. Similarly here, here, here. And here. So we have removed any excess bond in between the contact areas. Now we will cure. Start curing. We will cure all the buccal surfaces as well as the incisal and the palatal edges. Now incisal. This procedure we will repeat on each and every tooth. I hope so far I have been very clear in making you understand the cementation technique for the procedure of porcelain veneers. The curing of all the upper teeth has been done. Now I am going to gently pick the veneer by one from the tooth model. I can pick it up and then stick it onto this small stick. It is called as a pick and stick for the veneer. So it's very easy to load the cement in this manner. I have intentionally placed my model here on the towel because I feel much safer transferring the veneer from the model to the patient's mouth rather than going from the other distance where there is high risk of veneer falling down during the retrieval of the veneer from the model to the patient's mouth. I don't want to take any such kind of chances. Now here I have dispensed a small quantity of the cement into the veneer and remove the excess with the back of a round-ended plastic instrument. We keep it at one side. Now I am going to go and seat the veneer onto the tooth surface like this. See how convenient it is. Now I am going to remove any excess cement first before curing with the help of another small micro brush tip. This is to shorten the treatment procedure later on so that we don't have to get into the nuisance of removing the excess cement, which invariably reduces the gingival bleeding as well, plus it is very cumbersome. See from the back also, see the fit. The veneer is sitting gently. I am going to press it a little bit with my hand so that I make sure that it doesn't move from its place when I am trying to cure it, and all the excess is being removed again. Now my assistant will gently tap cure it first for a few seconds, and now we will do the complete curing of the buccal surface. All the veneers have to be cured from the buccal, cervical, incisal and proximal surfaces on the both sides one by one. There is no shortcut for this procedure. If you will follow shortcuts, the bonding will not be proper and your veneers will later on pop out. After you place one veneer, and again we will use a cloth so that if there is any excess cement in the interdental area, I can remove it so that it doesn't interfere with the seating of my next veneer. Similarly, I am now going to lift the second veneer, again load it with the cement in the same manner. The instrument seated onto the tooth surface with the help of this pick and stick. The excess flash of the cement coming out. Again I am going to gently remove it with the help of a micro brush. See the fit of the veneer from the palatal side itself as well. Now we are going to gently tag cure it first. That's it. I am going to remove the excess flash with the help of we can easily remove the flash at this stage. It's very difficult and cumbersome to remove it later on when it has fully cured. So this way, when we have gently tag cured, the veneer will be in place and we can again use the floss in the interdental area so that excess cement is removed. We will repeat this process on all the tooth surfaces now. application of the lower veneers. Same steps. First step, I will apply the etchant on all the teeth, followed by the rinsing, followed by the application of bond, then curing it. Light to bond on all the lower veneers. As I showed you in the case of upper ones, we have to rub the bond literally into the tooth surface so that it impregnates very well. See here, if you can guys appreciate the difference and the dramatic change in the color that we have brought. This is with the veneer on, and this is the original mottled tooth of the patient, which he was very concerned about and wanted to change the shade. So you can compare the difference yourself. Of course, I will show you the pre and post treatment pictures also at the end of the video. So here guys, I am extremely excited to show you the final case after the cementation of all the upper and lower 20 unit teeth veneers. Just have a look here. So all the veneers are perfectly in place, cemented, clean, flossed, everything. Alright, now I am going to remove this retractor. Show us your smile, Tejinder. Beautiful smile. Give him a mirror. Just have a look. So, how do you feel?
Good.
Can you please be a little louder in your reaction so that everybody can hear you?
I feel happy.
Extremely happy?
Yes.
This is the result you were wanting and desiring for?
Yes.
Alright. Now I'm going to give him some instructions and check the occlusion. Now let me show you guys my face once again. I hope you understood the process thoroughly. So basically we have to etch the veneer, apply the silane, wait it to dry. Then we have to apply the etchant on the tooth, apply the bonding agent, cure it, then load the veneer with the veneer luting cement. In this case I have used 3M cement, and then place one by one, floss each side, cure it properly from all the surfaces, all the 5 surfaces, which is buccal, cervical, proximal and palatal or lingual surfaces. There are no shortcuts. So I hope you like this video. Please leave your comments below in the comment box and subscribe to our channel and like it. Thank you.